The issue of replacement therapy in the Arabian Gulf country is a huge social issue, not just a scientific or medical decision that should be taken by the treatment center, because there's so much hurdles that we had to overcome in order to convince the decision makers in order to accept the issue of replacement therapy in the treatment of opiate addiction. Kuwait is not exception. We had this kind of hesitation from the decision makers, from all the levels, from different areas in the political system. And we had to be ready to answer so many questions. And it's not only that. Unfortunately, we had our own reservations as well and hesitation before deciding to start the replacement therapy here in Kuwait. Myself, I was being told by one of my mentors that if you are working in a center that has no replacement therapy, never ever take the decision to introduce the replacement therapy in that center. This kind of stigma or, the kind of a thought I had through my training and so on continued to be a big issue in my mind while, reading about the necessity of introducing replacement therapy and the issue of, not to introduce a replacement therapy. So to cut a story short, when we decided to introduce the replacement therapy here in Kuwait, we wanted not to copy and paste programs from abroad or from other centers that have been working with the replacement therapy for so many years. We wanted to have our own tailored program that suits the social system here in Kuwait, that answers so many questions and what is in the mind of the decision makers in Kuwait, and as well satisfies us that we are not going to cause more problems than solving the problem we had. So this is, from the start, this has helped us to decide which medication to choose. Will we be choosing methadone or Suboxone? So we decided on Suboxone because it is easy to be introduced, as it's a film. It's a velotab, so it will be, given by the nursing staff to the patients, and they will observe the use of the drug properly. Then, because of the combination of naloxone and buprenorphine in the same formulation. So that was one point. The other point, which is very important, we decided that there is no home take medication. The patient will come daily, every morning, to the hospital to receive his daily dose. There is no home takes. However, the patient who is doing very well, who shows motivation and is accepting to be involved in the rehabilitation program and shows so much of encouragement and motivation, then we'll give him a 1 week home take home supply. So this would be as a token. Other patients would like to do like him, so they will do that. Every single patient is recorded and followed up, so we know if there is some kind of leak of the medication into the market. I'm trying to use a layman word as well because this is very important. If there is a leak of the medication, then we know from where it happened. The other very important issue, we decided that if patient had 2 relapses while taking the replacement therapy, he's not going to be given a third chance. We noticed that patients started to come and negotiate with us the issue. This is my first relapse, so why you don't want to give me the my second chance? I still have one more chance, so you can't tell me no. So we decided to stop counting the numbers. The why you have relapsed is the main issue that will decide whether we are going to give you another chance or not. So by this, we had less and less relapses on Suboxone. The leak of Suboxone is almost zero. Almost zero. I can't say it's zero, but it's almost zero. And we are in very much control of how many the relationship between us and our patients who are receiving the replacement therapy. So tailoring a program that suits the community is an important issue. Actually, this is a nutshell. I'm not giving a minute detail of how we are dealing with our Suboxone treatment replacement therapy here in Kuwait, but this is just to show you that we tailored our program. Is not a copy-paste, and that helped us a lot in improving our relationship with our patients.